Welcome back to another video, everybody. I have the microphone today. It's currently Monday, so there is construction outside. But I'm actually really surprised that there is because it's extremely cold outside. Like, it's dangerously cold outside. I think it's probably like -2 right now with a wind chill of -13. But yeah, I am preparing to start next semester tomorrow. And so for today's video, I wanted to recap both last semester as well as my clinical rotation. I think I had said that I was going to make two separate videos for that, but honestly, I think I'm just going to clump it into one. So it's just easier. I don't want to have to film two different videos for it. But tomorrow is the start of third semester. And again, like, we're in this cold front for like 3 days now. Yesterday, I think the high was like 6. Today, the high is 2. Tomorrow, the high is 1. And I have to walk to school. I'll probably end up taking the bus, but honestly, I really don't like the buses. It's not that I don't even trust it, it's more that I'm not from the city, so I'm not super familiar with the bus system, and I guess I kind of don't trust it. But I have like a mile walk to campus every day, so it'll probably be negative by the time I'm walking to class. I don't know, we'll see. Maybe I'll walk, maybe I'll bus, but that's the tomorrow problem. I digress. I wanted to get my body moving, so I did some yoga this morning. I did a workout over the weekend, just like an at-home thing because it's too cold to go outside, so I didn't want to walk to the gym, but pretty sore from that actually. And there's a reason for that. I'll get into that when I recap my clinical rotation, which was a very interesting experience. But first, I'm going to start with second semester, last semester. So, as a reminder, I'm a current DBT1 here at the University of Wisconsin-Madison. Our program starts in the summer, so summer of 2024 was our first semester, and then fall of 2024 was second semester of our first year. And I already made a recap video of my summer semester that I will link if you guys want to watch that. But on to this semester. I think I had mentioned the stress I had experienced over that summer semester, not only because it was accelerated, but it's the start of grad school and you're taking a lot more challenging courses and the stakes are higher with the B requirement. So this semester, I feel like the stress just heightened. So this semester we took a total of 16 credits. I actually have my course sequence here because I kind of forget sometimes. We had 5 classes total. And so basically our like course sequence each semester is pretty similar. Usually there's like 3 or 4 like core classes, and then there's always a seminar of some sorts, and every class pretty much builds on itself. So a lot of what we did over the summer is a continuation of what we did over the fall, and now with these classes it'll be a continuation going into the spring, which is really nice. It's like the content comes back. It's not something that you learn one and done. So in terms of the classes that I took this fall, we had a neuroanatomy class that was entirely lecture. We met like 2 times a week. And then I had mentioned that over the summer we took like an intro to the applications of physical therapy class. And so this fall we took just a continuation of that, where we did a lot more evaluation, history taking, documentation, tests and measures. And then this spring, building on that, it's all like interventions. So my neuroanatomy class was 3 credits. This foundations of physical therapy class was 4 credits. And that one we had a lecture and a lab component, primarily lab based class. Our seminar was just 1 credit. And then we had a clinical decision making class. And so that's a 2-part class had our first one this fall, and then now the spring is the second half of that. And that's a lot of like learning different specialties of physical therapy, different conditions, different environments you work in, a lot of basics to like vital signs and a lot of like warning signs, or like if you're in the clinic and somebody has a DVT, deep vein thrombosis, like how do you deal with that, like learning what it is, how it presents, and then how to refer for that. Did a lot of radiographs, x-rays, imaging, things like that, learning like how it works and then how to read it. But yeah, so the first half of that course, actually, you know what, I'll get into it. But then our last class was like biomechanics, tissue mechanics, kinesiology, things like that. That was a 3 credit class. The clinical medicine was 5 credits. So the clinical medicine class was only lecture. It was scheduled for 3 times a week, but the schedule changed a lot. Some days we didn't meet all 3 days. Some weeks we only met 2. And then our biomechanics class, we actually only met once a week, but that was a lot of outside on your own, like asynchronous learning. Yeah, it was a lot. So, going down the list, I'll talk more in depth about each course. First one was neuroanatomy. That class I was really excited for because of my interest in the brain and neurology and my background in psychology. And some parts of the course was recap, but most of it was all new content, and that wasn't something I was expecting, I guess. Like, I don't know, I thought I had learned it all and this would all be recap, but that is not at all the case. And it was a challenge for me, and it threw me off guard for a bit. We had a really great professor. Like, we loved him so much, but the content was difficult. And so it was broken down. We had 3 exams, and that was like the entirety of our grade. My Foundations of Physical Therapy course, again, this is a continuation of our like applications course over the summer. Same professors and everything. It's primarily lab based, so it's a lot of hands on. I feel like if anything, that course is what guided me and supported me in my clinical rotation that I'll get into. But this semester was primarily learning all about the evaluation process, like the history taking, tests and measures, things like that. Our very first week, I think it was the very first week, like very first full week of this semester, we had to go to the hospital to our sim center and actually conduct like a interview, like a history taking of a patient. And how it works is these are real people, but fake patients. They're actors or former physicians playing the role of the patient. So we have like our whole list of questions and everything that we could actually bring with us and take into the room, but it was really just to get us in the mindset and like being the role of the physical therapist. And honestly though, as stressful, well, as nerve-wracking as it was, I wouldn't say it was necessarily stressful, but as nerve-wracking as it was, like as soon as I got in and sat down and introduced myself, like the conversation just flowed. Like it was nice that we could have the outline in front of us, and we will as future PTs anyway, so we pretty much just had a script to build off of. I remember though, just knocking on the door. You walk in, or it's like this big open area, and then there's different rooms because 4 of us, I think it was 4 of us, went at a time. So it's different treatment rooms, and it's like it was like Monsters Inc. when they're like waiting in line to go into the doors for work for the day or whatever. It was funny. That's what it reminded me of. But yeah, we'd hear over the speakers like time to enter the room, and then we'd have to knock and ask if we can enter. That was probably the most uncomfortable thing because I was like, what do I even say? I'm like, hello, like, can I come in? I introduced myself as soon as I got in, sat down, but then after that, like the conversation just flowed and it was nice. So then after that, we got more hands on learning goniometry, manual muscle tests, cranial nerve screening, joint play assessment, neurodynamic testing, balance, all sorts of things. And so we had our skill checks, forget how many we had, 3 or 4, on top of exams and everything. And then towards the end of the semester, we started doing inpatient assessments, and that was learning assistive devices, gait mechanics, lines and leads, things like that, and then just how to like navigate around a hospital room. And so we went to a community college, and they have like a sim lab, learn how to use the bed and different like lifts and hoisters and everything like that. So that was really nice. But then our final skill check was an inpatient evaluation. And that was probably the most nervous I've ever been. I was to the point where I thought I might pass out. Like, I don't know. So it was in the sim center, but it was different from where we were at the beginning of the semester with our like history taking assignment. This was like rooms that look like you were in the hospital. And so we had a ungraded practice for that, like a week before, a couple days before, depending on when you were assigned your final. And that was ungraded, so that was a really nice practice. And because our class is an uneven number, we only have 39. That means that somebody was going to have to do the skill check twice because we were in pairs for it. So just because of the uneven number, somebody was going to have to do it twice. And the way that the professors assign partners is just random. And I was picked to do the practice twice. And I was really nervous for it. But honestly, like looking back at it, I'm very grateful for it because I had that extra experience. And so we had 2 different patients. I had 2 different partners, 2 different patients. So it was nice to just like have different experiences, but basically kind of similar to what we did at the beginning of the semester, do our history taking, A&O, are the A&O times 4, blood pressure, like pain scale, things like that. And then assuming everything looks good, we would do bed mobility and determine if they're appropriate to try to sit, and then we would do seated balance and then determine if they're appropriate to stand and do some walking. So our professor gave us feedback on that, and they actually gave us really good feedback. So heading into the final, I remember me and my partner got there like half an hour early just to like sit and relax and prepare, and I was like seeing stars a little bit. I was pretty nervous. And she kept saying, cuz we had practiced like the day before and everything, and we had literally just done the actual practice too, but we were doing well. We knew what we were doing. We had a game plan. It was just time was nerve-wracking, and then making sure that we hit all the safety protocols. But honestly, I feel like I was nervous for nothing because our skill check went great. It was kind of funny because she would be like, our professor, when giving us feedback, she'd be like, oh, like, I like how you did this, or I like how you said that. Like, what was it that you did? What was it that you said? And honestly, both of us, like, we blacked out. We got in there, did our thing, and left. Like, I don't know. Like, we blacked out. I couldn't think of anything that I said or did, but we got through it and did pretty well on it. So I was very proud of us for that. So when it came down to finals, there were 2 classes where I was like just on the cusp. Like I was passing every exam with an 80 or whatever, but like I was like an 80. So going into the final, it's like if you don't pass the final, then you're not going to pass the class. And that was probably like the most terrified I've ever been. Like this was make or break. I hate to say it, but like I feel like I work the best when I'm under pressure. Like when I'm like it's now or never type of situation. And so luckily I passed all my classes. I passed those final exams, but like I don't want to feel that again. So going into next semester, I'm going to try to like really hit the ball rolling, make sure I'm studying daily. And I think like what it was that in undergrad, I mostly just reviewed like flashcards and got away with it. But now I have to be like more proactive with my studying and like dig deeper into understanding like why it is the way that it is rather than just like what it is and definitions and things like that. So that's something that I realized last semester, but I think it was a little bit too late. And so, like, going into the final exams, it was like if I hadn't passed the exam, then I wasn't going to pass the class. It was just 2 classes. The other classes I was okay in, but still, 2 classes is way too many. overall, the semester went well. I was just extremely stressed out. But towards the end of the semester, I got myself into a better routine. I'm trying to like really balance my like student life with my personal life, going to the gym, self-care, things like that I'm going to try to continue going into my spring semester. But yeah, it's over and now I'm moving on to next semester. But before I wrap up the video, I wanted to talk more about my first clinical rotation. It was a quick 2-week rotation, and I think I had mentioned this in my previous video, but where I was placed was the same clinic I had worked at as a tech. So I was familiar with the clinic setup and the physical therapists that worked there. And it was also just right here in Madison. So it was like a 10-minute drive from where I live. So it was nice. I feel like even though it was only 2 weeks, a lot of people had nerves going into it, but I had experience at this clinic. It was just an outpatient ortho clinic. So I had a little bit more ease going into it. And I think it also helped that I had previous experience as a tech. I had 2 different CIs. The first CI was also our or the clinic director. So he was able to provide a lot of insight into like how a clinic functions successfully, how it operates. He showed me more about billing and things like that. And then the second week I was with a different CI, and she's actually a good friend of mine, and she graduated 2 years ago. My first CI has been a physical therapist for like 25 years, I think. So it's nice to have different experience levels. But yeah, the first week, it was just a weird schedule. Like, I don't know. And it was weird for them too. We had a lot of cancels. So there's just a lot of gaps, and there wasn't a whole lot of opportunity for me to practice my skill set. But on top of that, you guys, I was so embarrassed. The second day, I had this whole plan for the 2 weeks. I was gonna like cook healthy meals, I was gonna establish a gym routine. It's gonna be great. But the second day, I was making dinner and I sliced my finger trying to open a can. And what's even more embarrassing is that I did something similar like 3 months ago. I had like opened the can and then I was dealing with raw meat and it slipped out of my hands and I tried to catch it and then it like sliced me like right on the top of my hand. But this one was like right in the soft tissue. So it was worse than the first one. The first one, I could just, it bled for 10 minutes and was fine. But this one was not. And I ended up having to go to urgent care because it wouldn't stop bleeding. We had to decide if we were going to do glue or stitches. I think they had wanted to do stitches, but because it was like really, it's like right on the crease of my pinky finger, it was kind of an awkward angle for them to do sutures. So they ended up going with the surgical glue, and it took like 3 layers of glue before it finally stopped bleeding. So it was a lot worse than I thought it was. And then I had to keep it bandaged like pretty tightly, heavily immobilized for the first like 3 days or so to make sure that it didn't continue bleeding. And so that kind of ruined the rest of my first week because there wasn't much that I could do anyways. But it worked out because it was just a weird schedule and there wasn't a whole lot of opportunity there. But I was able to do like similar to what I had done as a tech, taking patients through their exercises, making sure they were compliant with their home exercise program, but I wasn't able to practice like what we had learned this past semester with the goniometry, the MMTs, things like that. But the second week, I was with now the other CI. She's a good friend of mine, and there was a lot more opportunity. Not only my finger was getting better, wasn't quite there yet, but whatever. I was just not going to let it ruin my opportunity. There was just a lot more evals that week, less cancellations. So I was able to practice a lot of history taking, like the subjective portion of it, goniometry, lots and lots of MMTs, which was really great. Over the semester, we practiced it, we knew what it was, we knew what we were doing, but we were just practicing on each other. So we are, young, strong, healthy adults. We don't have a condition that brought us to physical therapy. So it was nice to practice on, different ages, different genders, different conditions. And then we'd give them grades and everything. So I got to practice all that. It was interesting to see the goniometric measurements, comparing side to side, seeing discrepancies there, because again, when we were practicing in lab, we all have good range of motion. So it was pretty close to the normative values, anyways. So it was just really good practice. And she gave me good feedback. Both of them gave me good feedback. Yeah, overall, my first clinical rotation was a great experience. I was very thankful to be back at a place that I had worked at previously. And after talking to some of the second years and just different people in my class, people debate whether or not they want to go to the same place that they've worked at, especially as when you're transitioning from like tech to student, because the responsibilities as a tech are different than the responsibilities as a student, but your CI only sees you as a tech, whatever. But because it was my first one and it was a quick 2 week rotation, I felt really comfortable there, and they were great at, seeing me as now a student rather than a tech. I had more responsibilities, was able to do more hands-on stuff. The other thing is that one of my CIs specializes in women's health, and understandably, there's a lot of privacy that goes into that. And so when I was working there as a tech, I didn't really get to see the modalities, the treatment modalities, the interventions that you do with pelvic health, but that was different this time around. I was able to sit in on some of them and learn some valuable experience with it, because I hadn't had a whole lot of knowledge in the field, and I'm still learning a lot. But yeah, it was just a great experience. If I have any recommendations going into your first rotation, again, I don't know how the other programs around the country, around the world are set up, but my biggest piece of advice is just to like review a little bit. Don't have to go in depth, but review a little bit of what you had learned that previous semester that you think would be applicable for your rotation. So for me, it was reviewing like goniometry and the manual muscle testing. And that way I just felt more comfortable actually putting it into application. And I actually got good feedback from my patients who wanted to know more about me. And I would tell them that I'm a first year and this is my first rotation. And they're like, wow, like I would never guess that with your level of confidence. So the other thing is, and this has been my motto so far, and it probably will be, I may have said this before, but like fake it till you make it, like what you know. It's there in your brain somewhere. Don't be afraid to ask questions. Like, don't be afraid to review your notes. Like, your patients understand that you're a student. You're just trying to learn. So it's okay to make mistakes. That's what your CI is there for. So, yeah, put yourself out there. It's going to be a little bit uncomfortable, but that's how you learn. That'd be my biggest piece of advice. And so we start classes tomorrow. Heading into this next semester, I'm just going to try to be more proactive with my studying, not wait until like a few days, week before to start studying for exams. I'm going to try start studying that material that I learned like that day, or at least 24 hours later, and just expand my studying. I think too, like don't solely use flashcards. Like we've learned all sorts of different study tips too that I could also get into in a different video. But yeah, I'm gonna try to really balance my personal life with my like school life. I definitely fell out of a gym routine this semester, and it's difficult because I feel like I need to be studying all the time, but at the same time, you do need to take rest and give yourself a mental break. Hopefully, next semester goes a little bit better than this semester. I know it's going to be very busy. We have a lot of things this spring, like a lot of outside activities. So, yeah, I'm excited. I'm ready, nervous, but I'm ready to get back into it again. I know I fell out of a film routine and schedule too, and I'm going to try to be better about that as well. But I need to give myself like a good week or two to get myself into a routine with class schedule and everything and see how it goes. And then hopefully I can film more and actually post more this semester. So thank you for being patient with me. I'm trying to figure this out as I'm posting this. That's what I wanted with this channel, is to like experience it with you. So I'm learning and trying to be better every day. Once again, like if anybody is applying to grad school or has any questions about anything, like please reach out to me. Put my contact here again. But yeah, like I'm happy to answer any questions. Take care. I will see you next time.